Are your legs feeling weaker than they used to? Struggling with balance, muscle cramps, or fatigue when walking or climbing stairs? You're not alone, and the problem might be a silent epidemic among older adults. Vitamin D deficiency. As we age, maintaining strong leg muscles becomes increasingly crucial for preventing falls, maintaining mobility, and living independently. In fact, falls are the #1 cause of injury-related death for adults over 65, and what many seniors don't realize is that low vitamin D can drastically reduce muscle strength, balance, and bone density, putting you at serious risk. In this video, we'll uncover science-backed strategies to restore leg strength, reduce fall risk, and improve mobility after 50, all by optimizing your vitamin D levels. We'll also share how to get more vitamin D through safe sun exposure, diet, and supplementation, plus how magnesium plays a key role in making vitamin D actually work. If you're a senior looking to regain strength, boost energy, and stay independent for years to come, this video is for you. Let's get into the vital steps you can take today to reclaim your health, starting with what's likely missing from your daily routine. Chapter 1: The hidden link between vitamin D and muscle strength. Vitamin D is widely recognized for its role in maintaining strong bones, but what most people don't realize is that it plays a critical and direct role in muscle strength, especially as we age. This isn't just a side benefit, it's a core function. Recent research has uncovered that vitamin D interacts with specific receptors located in muscle tissue, known as vitamin D receptors or VDRs. These receptors are responsible for triggering the genes that regulate muscle growth, contraction, and repair. Without enough vitamin D, these receptors don't activate properly, and as a result, muscle fibers, particularly the fast twitch fibers responsible for balance and sudden movements, begin to weaken. This is especially important for seniors. Fast twitch muscle fibers are what help you catch yourself if you start to trip or quickly rise from a chair. When these fibers deteriorate, the risk of falls, fractures, and mobility decline rises sharply. One fascinating fact many aren't aware of is that vitamin D deficiency doesn't just affect strength, it affects muscle efficiency. In other words, the same movement takes more effort when your vitamin D is low. Even simple activities like walking, lifting groceries, or getting out of bed can feel more exhausting than they should. Vitamin D also plays a surprising role in reducing chronic inflammation, which is a common cause of muscle soreness and fatigue in older adults. By modulating the immune system, vitamin D helps calm down overactive inflammation, allowing the muscles to recover faster and work more efficiently. Another lesser-known point, several clinical trials have shown that older adults who correct their vitamin D deficiency can see measurable improvements in grip strength, walking speed, and overall muscle function within just a few months. So, while we often associate vitamin D with preventing osteoporosis, its impact on muscle strength, coordination, and balance is just as vital, especially for maintaining independence, preventing falls, and staying active well into your later years. Coming up next, we'll look at why seniors are at much higher risk for vitamin D deficiency and what you can do about it. Chapter 2: Why seniors are more likely to be deficient in vitamin D. As we age, our ability to maintain healthy vitamin D levels doesn't just decline, it's naturally compromised by several biological and lifestyle factors that many people aren't aware of. First, the aging process significantly reduces the skin's ability to produce vitamin D from sunlight. In fact, research shows that a 70-year-old produces up to 75% less vitamin D from sun exposure compared to a 20-year-old. Even if you're spending the same amount of time outdoors, your body simply isn't making as much of this vital nutrient as it used to. But that's just the beginning. Many seniors also spend less time outside, often due to mobility issues, chronic health conditions, or concerns about skin damage. Even when they do get outside, sunscreen, long sleeves, and hats, while important for skin protection, also block the UVB rays that stimulate vitamin D production. Then there's the issue of dietary intake. Despite its importance, vitamin D is naturally found in only a handful of foods, such as fatty fish, egg yolks, and fortified dairy products. Unfortunately, many older adults don't consume enough of these foods regularly, either due to dietary restrictions, changes in appetite, or medical conditions that affect digestion and absorption. Here's another critical factor. The kidneys become less efficient at converting vitamin D into its active form as we age. This means that even if you're getting enough vitamin D through food or sunlight, your body may still struggle to use it effectively. What's more concerning is that vitamin D deficiency often goes unnoticed, because the symptoms, fatigue, muscle weakness, joint discomfort, are frequently chalked up to just getting older. But in reality, they may be early warning signs of a deficiency that could be addressed and reversed. Shockingly, up to 40% of older adults are estimated to have insufficient or deficient vitamin D levels, and in some populations, the rate is even higher. Left uncorrected, this can increase the risk of falls, fractures, reduced mobility, depression, and even compromised immune function. That's why it's essential to understand not just why seniors are at higher risk, but also how to take proactive steps to correct it. In the next chapter, we'll explore the clear warning signs of vitamin D deficiency and how to tell if your body is trying to signal that something's missing. Chapter 3. Subtle Signs. You might be deficient in vitamin D. Vitamin D deficiency doesn't always announce itself with loud symptoms. In fact, it often shows up in ways many people never associate with a nutrient imbalance, especially as we get older. Let's start with one of the most overlooked signs: muscle weakness. Many seniors assume that feeling weaker or more unsteady is just a normal part of aging, but research shows that low vitamin D levels can directly impair muscle function, particularly in the large muscles of the legs and hips. This can affect balance, coordination, and even the ability to stand up from a chair or climb stairs. Next, consider bone pain, especially in the lower back, hips, or legs. While this is often mistaken for arthritis or general wear and tear, vitamin D deficiency can lead to a condition called osteomalacia in adults, which causes the bones to become soft and painful due to poor calcium absorption. Another surprising sign? Fatigue. Not just tiredness, but that deep, dragging exhaustion that doesn't go away with rest. Vitamin D plays a role in cellular energy production, and when levels are low, many people report feeling chronically drained, mentally foggy, or even mildly depressed. There's more. Slow wound healing, like cuts, scrapes, or bruises that take unusually long to recover, has been linked to inadequate vitamin D. This nutrient helps control inflammation and supports tissue regeneration, both of which are crucial for recovery, especially in older adults. You might also notice increased susceptibility to illness. Vitamin D helps regulate immune function, and low levels have been associated with higher rates of respiratory infections, including colds and flu. If you're getting sick more often than usual, your vitamin D levels could be playing a role. Even mood changes, such as feelings of anxiety, irritability, or low mood, may have a biological basis. Some studies have found a strong correlation between vitamin D deficiency and symptoms of depression, especially in seniors. Here's the challenge. These symptoms are often subtle and easy to dismiss. That's why testing is key. A simple blood test can reveal whether you're getting enough of this essential nutrient, and if not, it opens the door to safe, targeted treatment. In the next chapter, we'll show you practical, easy ways to boost your vitamin D levels naturally through diet, lifestyle, and smart supplementation. These small changes can lead to big improvements in strength, balance, and overall well-being. Chapter 3. Subtle Signs. You might be deficient in vitamin D. Vitamin D deficiency doesn't always announce itself with loud symptoms. In fact, it often shows up in ways many people never associate with a nutrient imbalance, especially as we get older. Let's start with one of the most overlooked signs: muscle weakness. Many seniors assume that feeling weaker or more unsteady is just a normal part of aging, but research shows that low vitamin D levels can directly impair muscle function, particularly in the large muscles of the legs and hips. This can affect balance, coordination, and even the ability to stand up from a chair or climb stairs. Next, consider bone pain, especially in the lower back, hips, or legs. While this is often mistaken for arthritis or general wear and tear, vitamin D deficiency can lead to a condition called osteomalacia in adults, which causes the bones to become soft and painful due to poor calcium absorption. Another surprising sign? Fatigue. Not just tiredness, but that deep, dragging exhaustion that doesn't go away with rest. Vitamin D plays a role in cellular energy production, and when levels are low, many people report feeling chronically drained, mentally foggy, or even mildly depressed. There's more. Slow wound healing, like cuts, scrapes, or bruises that take unusually long to recover, has been linked to inadequate vitamin D. This nutrient helps control inflammation and supports tissue regeneration, both of which are crucial for recovery, especially in older adults. You might also notice increased susceptibility to illness. Vitamin D helps regulate immune function, and low levels have been associated with higher rates of respiratory infections, including colds and flu. If you're getting sick more often than usual, your vitamin D levels could be playing a role. Even mood changes, such as feelings of anxiety, irritability, or low mood, may have a biological basis. Some studies have found a strong correlation between vitamin D deficiency and symptoms of depression, especially in seniors. Here's the challenge. These symptoms are often subtle and easy to dismiss. That's why testing is key. A simple blood test can reveal whether you're getting enough of this essential nutrient, and if not, it opens the door to safe, targeted treatment. Chapter 4. Easy ways to boost vitamin D. Naturally boosting your vitamin D levels doesn't have to be complicated. Yet it's one of the most impactful steps seniors can take for better strength, mobility, and immune health. Let's look at the safest, most effective ways to increase vitamin D, starting with something free and available to everyone. Sunlight. The body naturally produces vitamin D when exposed to sunlight, specifically UVB rays. But here's a key fact many people miss. Older adults produce 75% less vitamin D from sunlight than younger people. That means you may need more regular exposure just to get the same benefit. Experts recommend 15 to 30 minutes of midday sun exposure on bare skin, like the arms, hands, or legs, at least 3 times per week, depending on your skin tone and local climate. No sunscreen during this time, but do protect yourself if you're out longer. Next, let's talk diet, and here's where most people fall short. Few foods naturally contain vitamin D, but some are surprisingly rich sources. Fatty fish like salmon, mackerel, and sardines are among the best. Just 1 serving of wild-caught salmon can give you more than your daily requirement. Egg yolks also provide a modest amount, along with fortified foods like milk, orange juice, plant-based milks, and certain cereals. But here's a pro tip. When reading labels, look for vitamin D3, cholecalciferol, which is better absorbed and more effective than D2. Now for seniors who spend limited time outdoors or struggle to get enough from food, vitamin D supplements can be a game changer. Many experts recommend 800 to 2,000 IU daily for adults over 65, depending on individual health needs and test results. But more isn't always better. Always consult your healthcare provider before starting supplements, especially if you're taking medications or managing chronic conditions. And there's something else that's often overlooked: magnesium. This essential mineral helps your body activate and use vitamin D. Without enough magnesium, your vitamin D supplement may not be fully effective. Leafy greens, nuts, seeds, and legumes are great ways to boost magnesium naturally. Lastly, consider timing. If you're taking vitamin D supplements, take them with your largest meal of the day, especially one that contains fat. This significantly improves absorption. By combining sunlight, diet, and smart supplementation, seniors can take control of their vitamin D levels and enjoy stronger muscles, better balance, and greater independence. In the next chapter, we'll explore exactly how long it takes to feel the benefits of vitamin D and how to track your progress. Chapter 5. How long does it take to see the benefits of vitamin D? So you've started spending more time in the sun, added vitamin D-rich foods to your meals, or maybe even begun taking a supplement. But when should you expect to see real results? Let's break it down. Vitamin D isn't a quick fix. It's a foundational nutrient that works behind the scenes to strengthen your body over time. While individual results vary, studies show that most people begin to notice subtle changes within 4 to 6 weeks of improving their vitamin D levels. In the short term, seniors often report feeling more energetic and notice a subtle lift in mood. That's because vitamin D plays a key role in regulating serotonin, the feel-good hormone that influences sleep, mood, and brain function. But the biggest benefits, like improved muscle strength, better balance, and a reduced risk of falls, tend to build gradually. Clinical studies have shown that after 12 to 16 weeks of consistent vitamin D intake, older adults often experience measurable improvements in leg strength and coordination. These gains are especially noticeable when vitamin D supplementation is combined with gentle physical activity like walking, tai chi, or resistance exercises. Here's something even more important. Your progress depends on how low your vitamin D levels were to begin with. If you were severely deficient, it may take longer to rebuild your reserves and feel the effects. That's why getting a blood test, called a 25-hydroxyvitamin D test, is essential. It gives you a clear starting point and allows your healthcare provider to tailor your plan based on your unique needs. Another tip many people overlook: consistency is key. Skipping doses or giving up too early can prevent you from ever reaching the optimal range. Think of vitamin D like a savings account. It grows with regular deposits, not occasional windfalls. And don't forget, lifestyle factors like diet, sleep, hydration, and magnesium intake all play a role in how well your body utilizes vitamin D. To sum up, minor improvements may be felt in as little as a few weeks. Major strength and mobility benefits often appear after 3 to 4 months. And long-term maintenance helps protect bone density, muscle power, and fall prevention for years to come. In the next and final chapter, we'll walk through the exact steps seniors can take today to safeguard their vitamin D levels and maintain independence for life. Chapter 6. Simple steps seniors can take to boost vitamin D and protect their strength. Now that you understand how vital vitamin D is for your strength, balance, and independence, let's talk about what you can do, starting today, to raise and maintain healthy vitamin D levels. Step 1. Prioritize safe sunlight exposure. Sunlight is your most natural and powerful source of vitamin D. Just 15 to 30 minutes of midday sun, 3 to 5 times a week, can significantly boost your vitamin D production, especially when the face, arms, and legs are exposed without sunscreen for a short period. But here's a critical note for seniors. As we age, our skin becomes less efficient at synthesizing vitamin D from sunlight. This means even with sun exposure, you may still need to support your levels through diet and supplements. Step 2. Add vitamin D-rich foods to your diet. Certain foods are naturally high in vitamin D and easy to include in daily meals. The top sources include fatty fish like salmon, mackerel, and sardines, egg yolks, fortified foods such as milk, yogurt, cereal, and plant-based milks, mushrooms that have been exposed to UV light. These aren't just great for vitamin D, they also support heart health, brain function, and immune strength. Step 3. Consider supplementation. Many seniors, especially those living in northern climates or with limited mobility, simply can't get enough vitamin D through sunlight and food alone. That's where supplements come in. For adults over 70, most experts recommend 800 to 1,000 IU per day, though some people may need more based on deficiency levels. Vitamin D3, cholecalciferol, is often preferred, as it's more effective at raising blood levels. Always speak with your doctor before starting a supplement to find the right dose and avoid any potential medication interactions. Step 4. Don't forget magnesium. Here's a surprising fact. Your body needs magnesium to fully activate vitamin D. Without enough magnesium, vitamin D stays in its inactive form, offering little benefit. To support absorption, include magnesium-rich foods like leafy greens, almonds, black beans, avocados, and whole grains. In some cases, a magnesium supplement may also be helpful. Step 5. Get tested. Ask your healthcare provider for a simple 25-hydroxyvitamin D blood test. This will give you a clear picture of where your levels stand and whether your current routine is working. It's especially important if you've experienced falls, fatigue, or muscle weakness. Step 6. Combine vitamin D with movement. Vitamin D supports muscle function, but movement activates it. Pairing adequate vitamin D levels with strength training, balance exercises, or even daily walks can multiply the benefits. Research shows that this combination significantly reduces fall risk and enhances leg strength and stability in older adults. In summary, boosting vitamin D is one of the simplest, safest, and most powerful things seniors can do to maintain mobility, prevent falls, and stay independent longer. Through regular sun exposure, smart food choices, supplements, and gentle movement, you can build a strong foundation for healthy aging. These small changes can lead to big improvements in strength, balance, and overall well-being. Thanks for watching. If you found this video helpful, be sure to like, subscribe, and turn on the notification bell so you never miss our next tip for healthy, active aging. Take care, and we'll see you in the next video.